might be an involvement of the brain directly. Now, unfortunately, the IQ studies that have gathered over the course of the 20th century were highly contradictory. So the first thing that we did, everybody say, meta-analysis. So there were many different papers using sometimes enormous samples testing the IQs of sex offenders, including offenders against children, offenders against adults, non-sexual offenders, and then I grouped together all of the other studies that had samples of people who committed no offenses and people who had a mishmash of offenses. And sure enough, an average IQ, I put the gray line across, is 100. That's the population baseline average IQ. But the samples of people who committed offenses against children were substantially lower. And this is now over many tens of thousands of patients. The ends I have up here are numbers of studies in the meta-analysis rather than the actual sample size. So we did have some reason to think that, oh, there's something here going on. The sexual offenders against children, who of course have a large amount of pedophilia in them, have a significantly lower IQ than samples composed of people who committed other types of offenses. And what was interesting is that, of course, different papers use different definitions of what a child is when they talk about offenders against children. To some scientists, it's the victim was 18 or under. Some studies were more rigid. The victim had to be 16 or under, or 12 or under, and so on. But if you line up the average IQ of the sample with that definition of child, the lower the age definition of child, the lower the IQ in that sample. In other words, the more pedophilic the sample, the lower IQ in the sample. Again, that was a clue that there's something going on. But we're not quite sure what it is yet. It could be that low IQ offenders are more likely to get